reminders, please call in from a landline. Avoid using a speakerphone if you can, or hands-free phone or cell phone, as that can impact the sound quality. If you are having any sound quality issues, sometimes if you hang up and call back in, that will help to clear it up. In addition, a reminder that we are recording this webinar today, as we do all of our webinars, and we will send out the link for the recorded webinar to all network partners, and it will be posted on our website at www.cssp.org. Next slide. During the webinar, please send in any questions you have. At the end, we're going to have a question and answer period. You can send in questions at the end of the webinar during that time as well. And lastly, we will be sending out a survey after the webinar, and we do appreciate those of you who can to fill it out and submit it back to us, as it really helps us in developing future webinars and getting feedback on how things go. We do know, I'm going to introduce our presenters in a minute, but they are in Allegheny County with a storm watch, so hopefully their power will stay on for the duration of the webinar, but just in case, that may be something that occurs, but we're moving forward. So it's now my pleasure to introduce the folks who are leading the work of getR.E.A.L Allegheny that you're going to hear about today. Megan Good is the Manager of Reporting and Analysis for Allegheny Department of Human Services, and Shauna Hines-Lucadamo is the SOGI Project Manager for Allegheny County Department of Human Services. Welcome.
Thanks, Bill. This is Megan. I'm going to do, I think, most of our talking today, but Shauna will jump in if I misspeak at any point. Just quickly, I want to go through the flow of what we'll talk about. We're going to start by giving you some background on who we are, the structure of our organization, because I think that might impact the ability for us to do our work. A little bit of context for what had happened in Allegheny County prior to us starting with the getR.E.A.L project, and then highlight what our implementation plan and activities have been. And I think the more interesting parts, we'll be talking through what for us have felt like some really critical activities, how we're integrating our work with other activities going on at the department, challenges that we've experienced, and our thoughts on next steps. So this is an org chart that kind of shows our structure, and I don't typically like to share this because it feels a little bit boring, but I think it's interesting because we are situated, I think, at a different place than a lot of people doing this work in child welfare systems. So we work for a county agency, the County Department of Human Services. We are county-wide, but we're located in the Pittsburgh area, so for folks who don't know where Allegheny County is. And Shauna and I sit in the Office of Data Analysis, Research, and Evaluation, which is a support office within an integrated department that covers multiple program areas. So you can see that our Office of Children, Youth, and Families is just one of those program areas. So we don't work within that office. We don't report to the Director of Child Welfare, but rather we work outside of it, and then we collaborate with folks in child welfare as well as staff within our other program offices to move the work forward. So just to talk a little bit about where we were when we started this work with Bill and his team a couple years ago. Allegheny County has about 1.2 million folks living here. As a department, we serve about 200,000 people a year. And in child welfare, that's about, in each year, we probably serve a few thousand families. There were certainly some activities going on within the department before the getR.E.A.L work began, but I would say a lot of that was work that really laid a foundation, and it wasn't a really focused effort until we had the support of the getR.E.A.L team. So prior to 2013, there were some inclusion efforts going on throughout the department that were really isolated to specific staff who were, trying to move work forward within their units as they could, but there wasn't anything really organized or coordinated. In 2009 was the first time that we had any anti-discrimination protections here. That was added at the county level. As a state, we still don't have protection from discrimination for sexual orientation or gender identity or gender expression. So it's new to the county at the county level in 2009, and when we started this work, I'd say a lot of people didn't know that even that existed. So a lot of our education has also been around the protections that do exist. In 2010, we had our first department-wide task force, and that was started because folks from the community came to DHS and said, hey, here's a list of issues that we're concerned about. Will you please take a look at them and let us know what you think? And that was, the scope of that was certainly broader than child welfare. I think one of the items was related to child welfare, but also included concerns about our homeless shelters, services for seniors, dress code policies, confidentiality policies. It kind of ran the full gamut. And that task force lasted for about 2 years. I was on that task force, but we dissolved the task force because it didn't feel like the right group of people. We had representation from each DHS program area, as you saw them outlined in the org chart, but they weren't, the group was full of people who were interested and supportive, but we didn't have expertise, we didn't have decision-making power, and so we really weren't moving the work forward in a way that was meaningful. So at that time, the group was disbanded. I asked to continue the work, and they said yes, which is why it's located in the weird data analysis office, because that was my role at that time, and so it just followed me into that office. But one of the recommendations that came from the task force was to establish an advisory council, which we did. So we had a council, and then I had some intern support over the next couple years to move the work forward in small ways. And some of what we did at that time, like I said, it didn't make big differences, but I think it started to make small impacts that helped us a lot when we started to launch getR.E.A.L. So we had created an LGBTQ brochure, which I'll talk about a little bit more later, but it was kind of a Know Your Rights brochure for the community, and people have done a lot of those before where it says, hey, know your rights, and if you're not treated well, call this number, but it never actually, at least the ones locally, never laid out for people what they should expect to see when they're receiving services, like what does it look like if you're not treated well. So we outlined more of those examples and talked a little bit about our services in that brochure. And we also started to participate in Pride for the first time. We had never done that before, so 2013, we walked in Pride, and we started to table, and we've done that the last couple of years. So all of that, and then Bill and his team showed up and said, hey, do you want to work with us to implement or to pilot these guidelines related to managing information related to SOGI? And we said, yes, please. So I want to quickly outline what our plan has been and where we're at, and then talk about some more of the specific things that we've done that have been successful and where we've hit challenges, and then talk about some of the resources that we have to share if people are interested. So in the first year, well, I will just say that we're ending our second year, I think. So we're 2 years in, and for me, the biggest shift with this 2 years was that we were able to hire Shauna as our project manager, which has made a world of difference, having somebody dedicated to this work full-time. Prior to this, it was basically, I did it as a volunteer gig, and then we'd have an intern who could provide full-time support in the summer or part-time support during the year. So having a dedicated staff person has launched this work in a whole new way. So the first year was really a heavy focus on engaging our stakeholders, and when I talk about stakeholders, I mean everybody. I think Shauna managed to meet every single, somebody from every single community group that we could find in the Pittsburgh region, and took a lot of people to lunch, which helped us greatly because we have great connections in the community now. But the engagement was also within our system. So having lots of meetings and focus groups within child welfare, but also our other stakeholders like our attorneys groups, trying to reach out to juvenile probation and mental health folks in the mental health system as well, anybody who's interacting with our families. We did a lot of needs assessment activities. We surveyed caseworker staff. We surveyed other staff who are working with our young people, like folks in our independent living unit, so folks serving young people transitioning out of child welfare. We have an assessment unit, and we surveyed them as well. We had focus groups with youth as well as workers to really understand where people are at now. So, you know, asking about things like terminology, beliefs, attitudes, behaviors, so that we could have a sense of what our status quo was and what we were working with. One of the things that came out of that was a really strong need to focus on our workplace culture. So we kind of had a sense of that already, but the surveys really confirmed that people didn't feel even safe in their workplaces. So we looked at our survey responses. Our LGBTQ staff answered very differently when asked about the safety of the workplace and the welcoming environment than our non-LGBTQ staff answered. So having that type of information was really important for us to be able to share out with our leadership. And the first year was focused really heavily on trying to figure out how do we make the workplace safe, because if our staff couldn't be out and open, how did we expect them to work openly with our young people and our families? And part of that was also doing environmental scans. So going around, we developed a tool to go around to the different offices. We have seven different regional offices within child welfare to go through and look at the actual physical environments. If I were a family or a parent or a young person walking into this space, how welcoming or affirming would it feel? So we did that work as well. Second year, so like I said, we're reaching the end of our second year. This year has been focused really heavily on training and policy development. I'll talk a little bit more about policy in a minute. But our training efforts, we are rolling out a training of trainers model. We wanted to train our system in a way that we could build some sustainability. We figured that if Sean and I did all of the training, that wouldn't be very practical, but it also wouldn't help build sustainability and remove people's need for us. So we contracted with a community training team to train trainers to go back and train their agencies, and we're in the process of trainers being trained right now. One thing I didn't mention about our structure, so we as a department have about 300 contracted provider agencies. We do very little direct service provision in-house. Within child welfare, we do have county caseworkers, so we have about 500 or 600 staff to train here. Because when we train, we're not just training the caseworkers, we're also going to train administrative staff and all other roles. But our agencies who are doing out-of-home placement or providing services to families within their homes, those are all contracted agencies. So when we roll out our training efforts, the plan is to not only train in-house staff, but our other stakeholders as well. So figuring out how to support contracted providers as well as bringing training in for our attorneys and judges has been part of that plan. Sean is engaged in lots of case consultations, so people are starting to call us when things come up, which is exciting. We've had a DHS LGBTQ email address and contact information for a while, but I think in 4 years I got contacted maybe twice. And Shauna gets calls regularly, so it's good to know that people know that we're here as a resource and are reaching out. And then as we move into the next year, we'll continue to roll out training. It will be probably the heaviest part of our training will be in this third year, figuring out how to change our data systems to collect information related to SOGI will be an enhanced focus, and of course there will be lots of ongoing technical assistance in that time. Okay, so I think this is where it gets more interesting. Sean and I laid out some of what I think we feel have been effective practices that we've done or what's gone well, or stuff that's really critical to the work. So one thing certainly is active leadership, and I think no matter what you're implementing, this is always on the list. But I want to add a couple specific things here. So whenever I talk about leadership support, I like to use the word active because leadership support can look really different. But if you have a leader who says, yeah, I support this, but it's really passive. It's not usually that helpful. So some ways that our leadership have helped are is that they've been really supportive of communication that we need to send out going through them. So, for example, when we did surveys or we need to communicate with child welfare about training, especially since we are external to the child welfare office, it's important for us that communication comes from the child welfare director, and he has been supportive in doing that. So we draft language for him, but the communication going to child welfare is coming straight from the director. The director of our whole Department of Human Services has sent out memorandum to all of our staff as well as our contracted provider agencies stating his support for this work and outlining ways in which agencies are expected to serve the community as well as expected to engage with us to learn and enhance practice. So those have been really key pieces of support that we've received from leadership here. I talked a little bit about engagement. I'll add a couple other activities. Aside from meetings that we've done, we have an ongoing community of practice, which are quarterly meetings where we bring together stakeholders across the county. So we have contracted provider agencies, we have Department of Human Services staff, we have community members. It's a space for any and everybody to come together, and we have different topics each quarter where we bring in presenters to do an educational component. We have time for people to talk about what resources are available in the community, so there's resource sharing. And then we always have time for small group discussions for people to identify needs, unmet needs in the community, do action planning. And for us, this has been a really effective means of continuing to engage the community, because I don't know what it's like in other cities, but at least in Pittsburgh, there are lots of folks serving the LGBTQ community or engaged in some way, but it's really fragmented. And so the community has really responded well to this structure as a means of coming together and learning from each other, learning what people are doing, reducing duplication, and making connections, which has been really important. As we've started this work, we've tried to be really transparent, which for this has felt important because within the LGBT community, especially in Pittsburgh, there are very few, for example, job opportunities to do this work. So as we are hiring a project manager, it was really clear from the beginning that if we just hired somebody without an open process, that would damage our progress from the beginning, because people would be put off by that lack of openness. So one of the first things that we did in an attempt to be transparent was to have a public posting for that position and do that hiring, which I know sounds really small, but sometimes is really big when it's easier to just and quicker to just hire somebody. We also, when we did the child welfare survey, we shared out all of the findings, not all the findings, we shared out a summary of the findings with child welfare staff, which was also big and something that rarely happens. People fill out surveys all the time, but it's rare that folks receive a copy of what was found in that survey. So we also did that as a means of engaging people and trying to keep people in the loop, making them feel like, well, allowing them to see how their opinions and feedback are supporting our process. Another thing that we did was when we wanted to do a community training team, even though we knew of some great resources within the community, again, we want to do a public process so that other folks within the community had a chance to bid for those services, since, again, investment, especially financial investment in the community, is limited. We made sure to open that up so that, and design the RFP in a way that small community groups had a chance to compete for that contract. Let's see. Addressing workplace culture, I touched on this a little bit earlier. We know that many staff felt like if they raised a concern to supervisors about discrimination, it wouldn't be taken seriously. That was some of the survey findings. Or that the environment was not one in which staff could be out and open as a role model for folks that they're serving. So when we saw those findings, it was troubling. And We did a lot of work in the first year, but it's ongoing work to make sure that we're addressing HR issues as they arise. So Sean and I have a nice relationship with our Human Resources Department to do that work in an ongoing manner. But it's also about figuring out how we support supervisors and others around, knowing how to work with staff, becoming sensitive to these issues. So I don't think a lot of this we don't see as a formal part of piloting the guidelines and the get.R.E.A.L work, but we see it as a really important complementary process to work with HR, to educate HR on the issues, to train them, but then to also work with staff at all levels in an ongoing manner so that people know what type of work environment, what type of treatment in a work environment is expected, and then how to support and promote that. So another really small thing we do is at any training, on most of our events, we have postcards with the rainbow on it that has listed on the back ways to be an active ally. And as you walk through the department today, you see many more rainbows than if you'd walked through 5 years ago, which is, again, a small thing, but it starts to address workplace culture and signals to people that this is a welcoming environment. I already talked about the dedicated staff person. So our standards of practice, when we started this work, we weren't able to develop policy. We hope to have some really concrete policies about what would be expected when serving people who identify or perceive to be LGBTQ. There were reasons that became challenging, but we've worked a lot over the last year to develop what are called here standards of practice, which are guidelines really laying out what the best practices are and what our staff and what our provider staff will be held accountable to. So we have a standard that outlines the fact that conversion therapy is not and will not be supported. So in Pennsylvania, there has been guidance released that says that government dollars may not be used to pay for it, but it has not been banned. So we still have guidance from the department really clearly outlining that we are not to support it in any way. We also have guidance around what to do in residential and housing environments. And I use that language because our standards, even though when we started to develop them, they had a child welfare focus. Our standards apply to our whole Department of Human Services. So as we worked to develop them, we had to make sure that they were phrased in a way that they could be applied to mental health settings or homeless settings or senior centers, for example. So we developed 6 different standards. We're happy to share them with anybody who wants to see them. We certainly didn't start them from scratch ourselves. We built from what New York had already done. Same with the memorandum I referenced earlier. We also borrowed some language from New York there. So we really appreciate the support we've gotten from others to give us a start for our work, and we're happy to share anything that we have that people could build from. The standards we're finding are really critical because in the past people would call me and say, well, what's DHS's stance on how a trans person should be placed or housed in gender segregated facilities? And I would say, well, DHS doesn't have a stance, but this is the best practice, which carried much less weight than saying, oh, well, we have this standard of practice that you need to follow, and here it's already in writing, and directors approved it. We've just finalized them in the last month, and they'll probably be released in the next week or two in an email blast to our full network. But just in the last few weeks, I think one of the standards we've shared out maybe 3 or 4 times because we have provider agencies not using preferred names and pronouns, and by being able to give them something in writing that says, no, this is the practice you need to follow, it enables us to really move that forward in a more impactful way. Anything else?
No, this is Shauna. I would just add that the standards of practice are also a way to get at the operational. Did I say it wrong?
I don't know.
A way to operationalize the guidelines so that that we were getting ready, that we're piloting. So when we're looking at the guidelines, they didn't give a lot of direction around how do you do some of that. And so what we found that our staff really needed was clear direction around what does this guideline mean. And so we used our standards of practice as a way to make that more useful to the people in the field.
Yeah. And if folks will look at our standards, you'll see that even though it's more specific than the guidelines for managing information, it's still somewhat high level. So in addition to the standards, we'll be working over the next year to also develop tip sheets that go even more concrete. So, for example, the standard might say that no staff are to support conversion therapy. But then we have workers say to us, well, if we're in a family team meeting and the parents say, you know, I want to send my child to counseling with the church, you know, what are we supposed to do? Because this is family driven, so we should put it in the plan, right? And our answer is no, it shouldn't go in the plan. If it's something that's harmful to children, we shouldn't be supporting that. But at the same time, we recognize that staff don't have the background knowledge and the language to have that conversation with the parent about why it's harmful, and about, you know, about the damage it can cause. So to supplement that standard, we're working on a tip sheet that really lays out concrete information for them about conversion therapy, some sample scripts, so actual language that they could use to start that conversation with a parent or with a young person to get really even more concrete. Moving on to sustainability, this is something that we're trying to create sustainable practices here, and I would say it's certainly an area that's challenging. One of the things that's challenging about it is when you're in this work all the time and you develop some expertise, it's really hard to hand it off to somebody else. So I think for us, one of the key examples of that is training. We recognize that our system is huge. We have hundreds of stakeholders, and for us to do the training doesn't really build the capacity of our community, and that's what we're really striving for. So as we implement our training of trainers, you know, we'll be sitting in a training and watching other people train, and sometimes that can be hard because, you know, we want to just step up there and do it ourselves, and we sometimes ask ourselves, why aren't we just doing the training? But the thing that we remind ourselves of, and I think need to stick to really planning for, is the fact that we are building that capacity within our offices, within our provider agencies, so that when those small things come up that we today don't hear about and we won't hear about in 3 years, that there will hopefully be somebody on site who can help staff members troubleshoot issues in a more positive way than maybe they're being dealt with today. In addition to the trainers, we have established within our department a champion network. So they're called our LGBTQ-A champions, and we add A to the acronym, or we did in the beginning at least, because we wanted to be really clear that we welcomed allies to be part of that group. We formed that group earlier in our development as an agency, and I think for me one of the biggest wins over the last several years was about 5 years ago when the advisory council was around. I guess it wasn't even 5, 3 or 4 years ago. We had talked about starting an affinity group within the department, and people really clearly felt like, no, that would just target us more. We had a meeting in 2011 where folks who were advocates for this work in the department came together, and I said to them, well, how should we establish a network? How do we build capacity? And at that time, people didn't want a listserv because they didn't want their names to be on a list associated with LGBTQ. So that, for me, is a pretty big signal of what the climate felt like for them at that time. And then just a few short years later, we had our champions meeting, and people come together for the champions meeting, and it's vibrant, and people on that list are willing to have their name listed on our intranet, which is a much more public showing than a listserv, and they're now coming out and marching in Pride. So I think the culture shift it's a symbol of the culture shift, but it's also you know, our task now to figure out how do we use this group and build their skills so that they can be that network throughout the department as we move forward. In the beginning, we had quarterly meetings with them that focused on different topics, but now in the last few months, we've shifted to those quarterly meetings all having a training component so that we're actively building their capacity. Making the ask, I have that here because that's one thing I've learned from Shauna is ask for what you want, don't assume you won't get it. We haven't had a lot of resources dedicated to us in the past, but by just asking, we've had some pretty cool things happen. Like we have a flag, a giant rainbow flag in our lobby right now. Our senior level of leadership allowed Shauna and I to do a safer space training with them where they were very vulnerable in exploring their, it was a lot of self-reflection, and those things would have never happened if we just didn't ask hard questions and just went along with what was easy. We're really intentional about integrating our work, and these are some things that I won't go into great detail about, but I just wanted to highlight them in case people have questions or if you're doing similar initiatives in terms of thinking about how we're integrating it. We have an inclusion committee at DHS which brings together all of the smaller efforts to foster inclusion. So we have representation from the LGBTQ work. We have people trying to improve services for immigrants and internationals, folks working on mental health stigma. So people who have their own initiatives are all coming together to say, how can we move our work forward with a broader voice? And one area where this has been big is restroom facilities. So to ask for gender-neutral restrooms for folks who might be trans or gender non-conforming really didn't get us anywhere. But when we're able to come to the department and say, here's a comprehensive review of our facilities and what needs to change to make it more inclusive for people who have disabilities, are transgender, families. When we're able to come together as a big group, the message was much stronger, and it's allowed us to move that work forward. Our crossover youth practice model, we have consultants in from Georgetown helping us with youth who are involved in both child welfare and juvenile justice, and we have representation on that work group to make sure that our LGBTQ youth remain an active part of that conversation. We currently have a diligent recruitment grant. This is about recruiting foster families, and our focus is on bringing in more families for teenagers. And we're actively involved with that planning group to make sure that as we're bringing in families, there's a really thoughtful consideration for families who are openly welcoming and affirming of LGBTQ youth. And as part of that, we'll likely have resources to train foster parents on sexual orientation, gender identity, and expression. We don't have a great orientation, but as folks are trying to plan an orientation, making sure that inclusion is part of that process, and that as staff are onboarded to our agency, they understand that this is part of the work. We have youth surveys. We have lots of different surveys that go out, but there are surveys going to youth and child welfare, so making sure that those surveys are inclusive of questions related to SOGI. And then finally, we're in the beginning stages of opening up a one-stop shop center for transition-age youth in Allegheny County, and we're actively working with the team who's responsible for rolling that out to make sure that staffing considerations are really thoughtful, and that the center itself is designed in a way that's really affirming and welcoming to LGBTQ youth. Challenges, I don't think I have actually covered these. In the beginning, we had a lot of pushback from stakeholders that we thought would be supportive. So you expect non-supportive people to push back, but we actually had a lot of pushback from people we expected to be our biggest champions. And it's hard to remember exactly why now because we've kind of passed that stage. But I think a lot of it was, for people who were the main game in town, a fear that they weren't being included at the level they thought they should be, or for some of our internal staff, it was a fear that things were going to get worse. For the people that we served, kind of that if we don't talk about it, it'll be okay, but if we start to share this information, people will screw up and will hurt kids and families. I think what we've found is that really actively engaging those folks and keeping communication open as we move along has helped significantly. Bureaucratic processes lacking definition. So when we started this, the process to report a complaint to HR was not necessarily clear. The process to create a policy was not necessarily clear, and it was really challenging. We spent a lot of time on issues that we felt should have already been defined, but a bright spot in that was that we were able to create things in our work that we might not have been able to create if there was a really well-defined process. So, for example, we weren't able to create policy because they didn't want policy that was population specific, and my feeling was that we were the first people to ask, and folks really didn't know what to do with that, except that it felt like a slippery slope. So that was frustrating, but at the same time, we were able to develop these standards of practice that were the first ones developed in our department, so we could really craft them in a way that fit our work and in a way that fit us without being bound by restrictions already set up. So if you are facing bureaucracy, I would say try to be creative because there might be opportunity in that. Another really big challenge that we've been talking about with Bill recently is documentation, and that's, I think, kind of the point of piloting the guidelines. So we need to figure that out this year. But an aspect to that we didn't expect was just how open our information systems are now that our case records are electronic and we're fully electronic here in Allegheny County. The scope of that access is huge, and so the implications for disclosure are pretty big, and that's something that we really need to get a better handle on. It's given the size of our information system and the fact that we're an integrated department, sometimes it's tough to even know who has access to what. So we're working on figuring that out, and then trying to think through how do we provide workers with concrete guidance about how and when to document, because people really want, do I document, do I not, kind of a black or white, whereas we're suggesting more of a gray area, asking them to really think about the youth circumstances and whether or not it's safe to document, given who has access to the system. But we have a lot of work to do there yet. And then one other thing that I think if people are, I don't know what stages other folks are at, but one thing that I think surprised us a little was the demand for our support once we started. So in our initial rollout plan, the hope was that our training, I think, would already mostly be done. It got pushed back because there's really massive system changes happening in child welfare right now. We had new administration, but there were also new regulations at the state level that changed practice significantly. So our training got pushed back, but even still, pretty much as soon as we began to engage our child welfare system, people were asking for and demanding training, which was really exciting to see, but at the same time kind of scary, because like, well, we have a plan for that, but that plan is 2 years out. So it's a challenge that we've had to balance, and something I would certainly recommend that other places be thoughtful about as you move into doing work, is how do you manage that scope, because it's really hard to say no. So you kind of want to go out and do that training, even though you know that it's maybe not the most efficient way to do the work, or that the curriculum isn't where you want it yet. But certainly for us, it happens everywhere that we go now, and trying to figure out how we prioritize the work. I think I've talked a little bit about next steps. We're trying to tackle documentation, so if anybody has really good ideas about ways to design information systems, we would love to hear from you, or if you have information systems that, for example, outside providers or the attorneys can access. Those are the types of stakeholders that we're dealing with in terms of thinking about what people can see. We'd love to know what you're doing. We're also continuing to do a lot of training in the next year, a lot of technical assistance, developing more of those tip sheets. We're happy to share those as we have them. As I'm talking about sharing, here's a short list. I thought about sending this out to Bill to send to all of you, but the files become really large. So instead, we have our contact information on the next slide in the PowerPoint, and I would just say feel free to contact us anytime if you would like to talk more about any of this, or if you want any of these resources, we're happy to just email them to you. One is the caseworker survey instrument. So I mentioned earlier on that when we began this work, we surveyed all child welfare staff to know where they were at. And again, it covered their knowledge, beliefs, behaviors, questions about workplace environment, questions about training, and that was really helpful to us. We have the copy of the RFP that we sent out to bring in a community training team, and then we're also happy to share the training curriculum that we've developed with that team. We have the PowerPoint curriculum as well as a trainer's manual. The memorandum that went out from our director, again, that laid out his expectations for our whole network related to serving LGBTQ folks. We've talked about the standards of practice. Again, we have 6 standards developed now, and we expect that we'll probably continue to develop them over time as needs arise. Right now, they're not publicly posted anywhere, but probably within the next week or so, they will be posted on our website. So we can also share a link at a later date. And then finally, the brochure for the LGBTQ community. I mentioned this earlier. This was something we developed with our advisory council several years ago. And we use this at any community outreach event. Has a nice rainbow on it, of course, to share with the community not only a list of the types of services they can receive at DHS, but an outline of what inclusive care looks like and what they should expect. What are some examples of ways in which they might be mistreated that would warrant a need for them to report it to us, and then a few different avenues for them to report that concern depending on how they would want to have it addressed. So I think that's the bulk of our presentation, and our contact information is on here, and I guess I'll throw it back to Bill and see if folks have questions.
Thanks, Megan and Shauna. So here's a question that came in. Among my organization's LGBTQ task force, one suggestion for placing transgender youth was to have a separate committee that could do case review and consultation. Do you think this would be a helpful way to address individual treatment needs? Clinicians and admission staff do not feel the guidelines are specific enough.
So this is Shauna. I'm going to try to respond to that. I don't know about a separate committee. Here it would, we're really moving forward on a conferencing and teaming model, and so having the youth really involved in the conversation around that is really important. I don't know how that works in a committee where the youth doesn't necessarily know everyone, and so we have it very, very youth-driven. The one thing that we're working on developing here, though, in addition to addressing those kind of questions, is, and I don't have a good name for it, is our SWAT team. It's not really SWAT, but that's what we're calling it right now, where we have a core group of folks, an attorney, a judge, somebody from behavioral health, child welfare, where issues come up that there isn't really clear guidance for, that we can call those people at a moment's notice and at least have a phone conference around how do we address what's happening, or how do we find guidance or make clear decisions so that we can serve our youth and families in the best way possible in a really timely manner. So we're in the process of developing that team here to address some of those questions that come up. Our guidance around housing, our standards are pretty clear, actually, and so I think that's been helpful for folks who have, and we did have a lot of those questions early on, but part of our standards really address that. I don't know if that helps.
I think it does. Thank you. And folks can contact you, excuse me, for copies of standards if they would be helpful in at least working from as folks continue to do this work. Another question is around intersectionality. I know you referenced an inclusion committee. Within your standards and training, do you address the issues around intersectionality?
That's a good question. Not as much as we want to. It's something that we've really thought about a lot and struggled with. So, for example, in the curriculum for the training of trainers, I think our initial outline was like 3 days worth of training, but it's a 1-day training, so we had to cut a lot back. And in that training, you know, we piloted the training, and we really asked folks to give a thoughtful eye towards that. So, you know, we had a diverse group of people in the room, and we said, you know, like, really give us really honest feedback about how this training feels, because we don't want it to feel like it's coming from, you know, your white, lesbian, cisgender trainer, because that's typically who's training this stuff, at least here. And I honestly don't know that we got a lot of feedback, but I think that folks are thinking about it. And what we did in that training was just weave in kind of an acknowledgement in the beginning. We have a nice little visual that kind of highlights all the different pieces of our identity that make us who we are, and we really deliberately acknowledge that people experience their gender and their sexuality differently based on all of these other parts of their identity too, because they mutually shape and form each other. And so just talking about SOGI doesn't really explain what this means for people, because it's what it means to be gay is really different for a white male in the city than a white male in the rural area, even if you keep some of those demographics the same. So we try to acknowledge that, and then a lot of the content we think is pretty neutral, though of course it might differ, and in some places then we just do our best to highlight some of those differences. So we have a module on health disparities, where we are more thoughtful about talking about how intersectionality affects people's experiences in the world, but then otherwise not that much. And in a lot of the LGBT training, it's limited. We do have a safer space training, which I mentioned. We do with our senior staff, and it was only mandatory for our office. Otherwise, we're offering it every other month on an optional basis to people in our department. And in that training, we really deliberately explore identity in an inclusive and holistic way. We don't focus just on SOGI in that. We talk about issues related to race, disability, income, all those things. So it's tough, and I would be honest saying that we're not doing it as much as we want, but you know, even as we're trying to bring together steering committees and groups, getting diversity reflected in our staffing and our work groups is an ongoing challenge.
Thanks. Can you talk a little bit about what kind of data system changes you're thinking about implementing related to SOGI? Sure.
I could try. So I think one of the things that we're thinking about, and Sean is doing more of this focus over the next few months, is thinking about not just adding fields like what's your sexual orientation, but providing guidance to workers about where they document this information in specific places where it already exists, where forms already exist. So, for example, we have a safety assessment and risk assessment, so providing guidance to our staff about where do they document this information within those assessments. So it's not necessarily a change in our information system, but specific guidance about documentation that feels really important to us. I honestly can't speculate at this time what documentation related to sexual orientation might look like, because we haven't explored that much yet. I imagine we'll probably start with gender because it's already documented, and so the need to make it more inclusive and make it work for people is more pressing and frankly probably easier because people see that need, they're experiencing that need. One of the things that I'd like to do there, we got the idea from a community group who's really small. They don't have an information system. I think they have an Excel sheet. And when they're working with people, they collect from them preferred name and pronoun, and then they ask, okay, in what settings and with whom should we use that information? So with family, what name and pronoun should we use? If I'm sending you mail, what should we use? If we're talking to providers, et cetera, et cetera. And I would love to try to figure out how we build that into our information system, because so much of our forms and what we mail is computer generated. So I'd really like to figure out how we build that in so that when we're doing a mass mailing, we're pulling from the correct name and pronouns so that we're not inadvertently outing people or using a name and pronoun that the person doesn't identify with. So I think that's the creative one that I would share that we haven't figured out yet, but that I'm hoping we can do.
Great, that's helpful. Can you talk a little bit more around the diligent recruitment? And I guess the context for the question is, in many places across the country, LGBT identified young people tend to end up disproportionately in congregate care. And I'm assuming that the effort of the diligent recruitment is aimed at helping to reduce the unnecessary placement of young people in care, in group care. Would you say that's accurate? And if so, what kinds of things are you thinking about besides training?
So one of the big moves we're making in child welfare, which is several years down the road, is to really reduce congregate care to almost non-existent. And so our diligent recruitment team, implementation team, is really focused on building our capacity within our current provider network to have foster parents and resource parents who can adequately support all of our kids who are in congregate care. And as we know here in Allegheny County, or at least we did a couple years ago, that a third of our kids in congregate care identified as LGB. So we know we have even a higher percentage than what's typically seen across the country. And so, so we're making some efforts in there around, one, right, training is a big one. So right now we're trying to work on creating a training for all current foster parents and resource parents. So people who are already doing it, we want to bring them up to some basic level of information and knowledge, adding it to the new pre-service foster parent training so that it's something that people get when they come in the door. Our standards of practice are being implemented across our agencies, including our foster care and adoption agencies, and they're expected to adhere to the standards, and that includes with resource families. We're also doing, there'll be a piece of it that does specific recruitment for LGBTQ affirming families. So we're trying to really hit it from a lot of different directions. And as Megan mentioned earlier in our Train the Trainer, many of our provider agencies are those foster care agencies that sent people to have trainers trained on their staff, and so that they can start to move this work forward as well. And so we're trying to hit it from a lot of different directions.
Thanks, that's helpful. And last but not least is judges. Can you talk a little bit about work with judges and how that's going?
Absolutely. So early on we got a little bit of time on the judges' docket to talk about this work, which was great because they're very busy, as people know. And we had a lot of good response from the judges about wanting to learn more, wanting to make their courtrooms welcoming places, affirming places. Judges are challenging, at least here in Allegheny County, but I imagine we're not an anomaly there. And so we've been really fortunate recently because we've had some volunteer training opportunities from Lambda Legal. So Lambda Legal is doing, I can't remember what the initiative is that they're doing, to go and train certain jurisdictions, their legal support, so judges, magistrates, hearing officers, anybody who's in the court system, plus attorneys groups, and they had offered to come to Allegheny County to do a training with our judges and all our folks, and they're going to come for 2 days, and we're going to have 3 different training sessions free of charge, which for us has been a real blessing because we don't have a budget to support that work, but we do have a few of our judges who are really invested in this work, and so they've been giving us the permission to do that and given us the time, which is kind of awesome. And so that's sort of where we're starting with them, which I think is a lot actually for Allegheny County because typically they have a hard time with getting judges to training anyway. So we've been really fortunate to be able to utilize the services and supports of Lambda Legal.
Great. Well, that's it for questions. Thanks so much for sharing, and hopefully in another year or two we'll come back and see how far things have gone. As noted, this is a session that's been recorded, and we will send out the link for the recorded version and also post it on our website at www.cssp.org. You can contact Shauna and Megan directly for any resources that you might want shared, and we will continue to build our website at the Center for the Study of Social Policy, and as we do that, if there are resources that make sense to post on our website, we will do that as well. So thank you. That's the end of this webinar.